Okay, so up to now, what we've been doing is visiting the placement once we've got a lead, either from yourselves or from ourselves here. We either set up a Teams meeting or preferably go out and visit and just have a chat to the practice nurses and the practice leads within there to see what kind of opportunities they could offer the students from Exeter. So that's the first initial step really so it's quite transparent between what our expectations are for the placement and what the placement expects from us too, and to see a familiar face when they come to get a student and have a visit from an academic assessor to the workplace. That's the first thing that happens.
And so if the practice then decides to go ahead and support a student, what is involved then in the process?
Well, the nurses in the practice have to be identified for the specific roles that for the NMC need to be able to support a student nurse. So in particular, those are practice assessors and practice supervisors. And we direct those practice supervisors, practice assessors to an online training resource that was put together in collaboration with the University of Plymouth that the nurses can access, go and have a look at and undertake the short mini e-learning to get them up to speed with the requirements of supporting a student in the workplace. The old mentorship role changed in 2018 to three new roles, which is the practice assessor, the practice supervisor, and the academic assessor, who's the link at the university for the placements.
So after the students finish their first placement with you, with the practice provider, how often would you contact them about further placements then?
So it's really, really important that when we set up a placement that they're utilised throughout the year by a university, because it keeps skills nice and fresh for them. So we share placements where with consent with Plymouth and the University of West of England at the moment, so that we can ensure that placements are utilised. So after placement has completed, we review the placement. We always give a call to check how it went, if they're okay, as well as talking to the student as well. We're doing a bit of a project at the moment because we've got about 5 or 6 first placements into primary care this spring. So we want to collate that information afterwards to check that our processes and systems meet everybody's needs, and that as much as we can get out of the placement as possible for the student. You know, we've explored all those areas, if you like, for the different practices. Um, and then we let the practice know when the next allocations will be, and then hopefully when we'll be able to allocate to them once we go through that process. So allocations are normally 2 months before the placement starts.
Fantastic. And you have three placement blocks over the course of the year?
So year one have two, year two have three, year three have two, and year four have two. The difference with year four is if the student is doing the adult and mental health dual registration, then they have those two placements in year four. If they've decided after year two just to go the adult route, a master's adult nursing program, their last placement in year four is an internship. So that's where they go, and they're much more autonomous in their clinical immersion. They sort that out themselves, preferably, and that's where we would be looking for people who want to work in primary care once they graduate, hopefully going securing an internship where they may well be employed afterwards. So that's
Fantastic.
quite exciting. Yeah.
Yes, yeah. So, do you have any particular advice for primary care practices or even social care settings considering hosting students?
I think if you're considering hosting students, talk to people that have hosted them. I
Mm,
think that's really key. That's probably what I've learnt through the last few years, really, that I've worked in placements with placements. Talk to people that have already hosted students because it's easier than you think. Um, Often placements will say they wish they had started earlier. It's brought a lot of value to their organisation, to their workforce, both ways as well. Students learn and the workplace learn. But that's one of the biggest pieces of advice I could have. You know, go and talk to people that have had these really positive experiences about having a student, and it's not as onerous as you think it's going to be.
mm.
You know, it's student led, it's electronic, which does make things easier. The recording documentation, there's a lot of support out there for you to make it a very positive experience.
And my final question, which is not one that I prepared for you, sorry, Kathy,
That's okay.
but I'll ask what the benefits are for the students. Do you want a couple of
Okay, yeah,
minutes to think
yeah.
about it?
No, that's okay. Okay.
Um, so, Kathy, I also wanted to find out what, from a university's point of view, you feel are the benefits for students undertaking some non hospital based placements in primary care or social care.
I think one of the biggest pictures is it gives the students a much wider holistic picture of health and care. I think in the past, rightly or wrongly, with just hospital placements, there's been a very narrow view of what a nurse's role is. And nurses going out into these maybe non traditional settings is actually demonstrating, and they're coming back with this kind of feedback. They're actually demonstrating how they didn't realise the extent of the nurse's role outside of a hospital setting. And they've been overwhelmed, flabbergasted by what they found and how busy and how acute primary care and social care can be. And I think that's probably the one of the biggest benefits to students for our nurses of the future to have that experience with the integrated care systems now on board and the collaboration between health and social care all coming underneath one big banner. It's really, really important that nurses have an understanding of every setting and that they're able to go and work in these settings after they qualify. So one of our visions are that our students do have all have primary care and social care experiences at some point during their 4 years.
Fantastic. And then that gives them this holistic picture of the patient's journey through all sorts of different settings, doesn't it?
Absolutely, because uh, um, you have in a hospital setting, for example, and this is feedback that I've had from a student, it's very focused on what the problem and the need is of the
Mm,
student. Whereas maybe in primary care and in social care, they also see the family history in a lot more detail. You know, the social, the economic, the psychological, they see a way bigger holistic picture of the person that they're looking after. And of course within social care it's that whole person centered picture that they're getting, whereas perhaps it's not so focused in a hospital setting because they're only meeting that one person for a short stay perhaps.
mm. And obviously, when you're in a residential home, it's their home, isn't it? So you get to see much more how they are in their home environment, don't you?
Absolutely. You're going to work in someone else's home in
Mm,
a social care setting, and it's a different focus. It's a different focus completely because you're sitting down having your lunch with your resident or your patient, if you like, you know,
yeah.
depending on what context you're looking at. So, and to have the students experience that is providing such a lot of information and skill and background knowledge for them. So when they do go and work in hospital, they know, for example, if a patient is being discharged into social care, they've been there on the other side of that discharge, so they know what it's like and what's going to happen. So
Mm,
the expectation is there. You know, so we're hoping that it joins up that little bit of a a barrier perhaps between
mm.
between the two areas when the
Yeah,
students have had a better picture of what happens on the other side.
absolutely. Lovely. Well, thank you for talking to us. Is there anything else you wanted to add to this interview?
No, I don't think so. Just to potential providers, don't be worried about ringing the universities up. You can make that step yourself and just ring up and say, I'd like to talk to someone about hosting students. That's absolutely fine. And don't forget the information on that last question on your PIR, the provider information return for CQC, to put that you're an approved placement provider, because that does go a long way as well. It shows you're very open to reflective practice.
Fantastic. That's a good tip.
Okay, thank you.
Thanks so much.